Okay, the next discussion we're talking about two things. So this is the claw hand and wrist drop. Claw hand, your hand is like this. Wrist drop, your wrist has fallen. You're not able to raise your hand like this. So all of them have to do with nerve injuries. A particular nerve that supplies the muscles at that region that help in the flexion and extension of that region is actually what's injured. Okay, so when you have nerve injuries in the hand, you could actually have a wrist drop or claw hand. So let's talk about each of them. So we are starting with the claw hand. So claw hand, just like I told you guys, is your hand is bent. Your fingers are bent abnormally. It could be some or it could be all, So it's a deformity where the fingers, usually the fourth finger and the fifth finger, they are hyperextended at the knuckles. Okay, so they are flexed. That's a metacarpophalangeal joint, but they are flexed at the interphalangeal joint. Like, I don't know if you understand it. One side is flexed, one side is extended. So to give you a claw-like appearance. Causes is due to what? Ulnar injury, ulnar nerve injury. Can also occur with combined median or ulnar damage. That's why I'm telling you that the amount of nerves affected depend on how many fingers will be clawed. Mechanism, there's loss of what? Intrinsic hand muscles. That's the lumbricals and the interossei. Okay, so there's no balance. There's imbalance between the flexors and the extensors. So your fingers are bent into a claw shape, giving you're not able to grab things again, a weak grip, and there's also difficulties with all those fine motor tasks, all those little fine things that you do with your hand, your ability to write, your ability to type on a computer. Then also sensory loss on the medial side of the hand. Okay, so wrist drop now. That's a radial nerve injury. Okay, wrist drop is a radial nerve injury. So for wrist drop, it's just inability to extend the wrist, causing the hand to hang limply when the forearm is raised. So maybe injuries to the radial nerve, often due to all those humeral shaft fractures, prolonged compressions. So it's actually called what? Saturday night palsy. Why? Because the person who discovered it made a funny story that you could actually go out on a Saturday to a party. So when you go to a party, you are drunk. When you sleep on a chair, you can drop your hand outside on your chair. So when you drop your hand on your chair, your armpit is resting on the head of the chair, right? So now because you are drunk, you just put all your body weight on that hand, so the radial nerve could get compressed as a result. So mechanism, there's paralysis of wrist or finger extensors. So there's now unopposed flexor pull, okay, which will now pull the wrist downward. So the wrist is hanging down and cannot be actively extended. So there's difficulties also grasping objects. All right. There's also sensory loss on the back of the hand and the posterior forearm. So for the wrist drop and the claw hand, this is what we got.